I think we ought to understand depression because the depression is a descriptive term, right? A person is depressed. It has also become a clinical term. He is suffering from a depression, right? It's a diagnosis like diabetes or pneumonia. Now, I think that there is a feeling of depression if there's a loss. A person has lost a family member, right? A person has lost his fortune. Those are realistic feelings of grief. It's a grief kind of depression. Again, antidepressants and Prozac are not going to change those, right? However, there is something within our system that our chemical system does affect the way we feel. And if we have certain disturbances in our neurohormones, right, it changes the way we feel and can give us a feeling of severe depression and despair. Right? Now, that can be brought on by anything, and sometimes out of the blue, maybe hereditary, right? Or a great deal of stress, insomnia, pressure can produce a biochemical depression. Now, if it turns into a biochemical depression, that's when antidepressants can help. So I think we have to be able to distinguish between the two. I can be depressed, but not have a depression. Right? Strangely enough, one can have a clinical depression and not be depressed, right? And it'll show itself is an inability to feel. Right? Now, I believe that when suicide happens, it comes from feelings of despair, and I believe that despair is almost invariably due to the biochemical change, where the person looks at a blackboard and thinks it's a window and sees the world as hopeless. Right? So I think we have to be able to determine what is it that we're feeling and why, and what is correctable, and how should it be corrected. Trying to do psychotherapy with a person who's got a biochemical depression, right, is like trying to tune the television set when it's not plugged in. Right? So I think we have to understand what the nature of depression is and be able to approach each part of the depression with what is appropriate for that.